Hi, my name is Shannon. I'm going to be your nurse today. So how are you doing today? Why did you come in?
I'm doing well. I just came in for a routine checkup.
Okay, great. Are you on any medications?
Not currently.
Do you have any allergies?
No.
How about family history? Any high blood pressure, cholesterol, heart disease? Do you have grandparents?
Yep.
Are they both living?
Yes.
And they're all healthy?
Yes.
Okay, great. So I'm just going to start with your capillary refill, and I'm just checking your circulation so we can see your fingernail. Okay, good. It refilled within 2 seconds, so you have good circulation. Okay, now I'm just going to listen to your carotid artery one at a time, so I don't block blood flow to your brain. My hands are a little cold, sorry. Okay, good. Good. I didn't feel anything unusual. You have a very strong pulse. Now I'm just going to listen using the bell of my stethoscope. Good. Nice clear whooshing sound. No bruits present. Okay, so now I'm just going to take your pulse. So I counted for 30 seconds, multiply that by 2, you had a pulse of 64. Are you an athlete?
Yes.
That's why it's nice and low. That's good. That means you're nice and healthy. Okay, so now I'm just going to feel your other pulses to make sure that they were just as strong. I'm going to feel your brachial, your femoral, which is right in here. I won't make you feel that. Popliteal. Good. Your dorsal medius, which is down here on your foot. Good. And then your posterior tibial. And they all had about a 2+ strength, which is very good, very healthy. Now I'm just going to ask you to lie on your left side so I can feel your apical pulse, which is your 5th intercostal space midclavicular line. That's where I can hear your mitral valve and your S1, which is the love part of the heart. Good, that's nice and strong, nice and healthy. And that's the apex of your heart, so like the point. So then the last thing I'm going to do is listen to your 4 heart sounds. So if you want to sit back up for me, I'm going to use the diaphragm of my stethoscope. I'm going to start in your aortic, which is your 2nd intercostal space right sternal border. And your S2 can be heard best here. Your pulmonic, which is your 2nd intercostal space left sternal border. Good. Your tricuspid, which is your 4th intercostal space left sternal border. And then your mitral, which is the 5th intercostal space midclavicular line. Good. I didn't hear any murmurs. Nothing was out of sync. Your heart is very healthy.
Yay.
Now I'm going to observe your abdomen. So I'm just going to ask you to lie down and roll your shirt up a little bit. And I'm just going to look to make sure it's symmetric. Good. That's okay. It's flat. No bulging masses. Your belly button is right in the middle. I don't see any scars or any striae, so that's good. So now I'm just going to listen, and I'm going to start in your right lower quadrant because your ileocecal valve should always be dripping, so it should hear a sound. Was it cold?
Yeah.
Sorry. Okay. Good. So I heard gurgling within 15 seconds of listening to each four quadrants, which is good, nice and healthy. Now I'm going to percuss your abdomen in a Christmas tree-like shape. I'm going to warm up my fingers for you. And I want to hear a timpani sound, which is like a dull, high-pitched sound. Okay, good. So I heard a dull sound, high-pitched, because the air is going to rise in your abdomen. Next, I'm going to feel your 4 quadrants, starting with light palpations. I'm only going to go about 1/2 of an inch deep. Tell me if you feel any pain. Okay, and I'm going to go a little bit deeper, about 2 to 3 inches. Okay, good. Now you can just bend your knees to feel a little more comfortable. I'm going to feel for your liver. I'm going to hook my fingers under your rib and ask you to take a deep breath. Okay? Good. So your liver was nice and smooth, didn't feel anything rigid. I'm going to feel for your spleen. And your spleen has to be 2 to 3 times enlarged to actually feel, so that didn't seem enlarged at all, which is good. If it was enlarged, we would be worried about mono. Now I'm just going to check for your kidneys, so tell me if you feel any pain. Okay, and if you felt pain, then I would check for your rebound tenderness. I would go on the opposite side of whichever side of the abdomen you felt pain, push down, and when I would release, I would ask you if you felt any pain, and I would do that on both sides. Okay, good. Your abdomen is perfect. Okay, so the last part of your physical, I'm just going to assess your lungs. So I'm going to start by checking your coastal angle, which is right between your rib cage, and it should be less than or equal to 90 degrees. Good. So it's less than 90 degrees, which is good. And then your anterior to posterior position should be symmetric. Yes, and it is. Okay, so I'm just going to ask you to scoot forward a little bit and relax. So I noticed that you have no pallor, no cyanosis, no jaundice, but you have some moles. Do you wear sunscreen?
Yes.
Okay, good. So now I'm just going to check for your systemic expansion. So I'm going to put my thumbs on your T9 and your T10 and ask you to take a deep breath. So if you could just scoot a little forward. There we go. Okay. Okay, good. One more time. Deep breath. Okay, good. So when you took a deep breath, my thumbs equally moved apart, so you have symmetric expansion in both lungs. And I would do the same thing on the front, where my thumbs would be pointing towards your xiphoid process. Okay, so now I'm going to test for your tactile formatus, which is going to be vibrations. So I have 10 different spots that I'm going to use the ulnar edge of my hand to feel. So when I move my hand, just repeat 99. Go ahead.
Repeat 99.
Just 99.
Oh, 99. 99. 99. 99. 99. 99. 99. 99. 99, 99. Okay, good. So your vibrations were palpable and they were strong and they were equal in each position. So I do the same thing on the front, but because you're a female, your chest I wouldn't be able to feel. So, and since I didn't feel anything unusual, I don't have to feel the front. Okay, what do I do next? Next, I'm going to percuss your lung field, and I want to hear sort of like a high-pitched hollow sound. So you don't have to do anything, I'm just going to listen. And I'm going to start up by your shoulders. And I'm going to be moving in 5-centimeter intervals across your back. Okay, good. So it was a nice hollow sound. We would hear dullness if you were either overweight, you had a mass that wasn't supposed to be there. So the fact that we heard timpani is very good. And the last thing I'm going to do is I'm going to listen to your breath sounds. So every time I move my stethoscope, just take a deep breath and tell me if you start to feel lightheaded. Okay, good. I didn't hear any turbulence, I didn't hear any wheezing, no crowing, everything sounded very clear. You have very good lungs. Don't smoke. Okay, good.